Myself, Dr. Avinandan Banerjee, consultant nephrologist and transplant physician attached to CK Birla Hospitals, Kolkata. Today I am going to speak on a very important topic called AKI or acute kidney injury. Acute kidney injury means there is a rapid shutdown of renal function over a span of few hours to few days, and it commonly occurs in hospital settings, mostly in admitted patients, mostly in elderly. But that doesn't mean that it doesn't occur at home. It can occur at home as well. Acute kidney injury is one of the most dreaded complications in an ICU setting. The most common causes of acute kidney injury are, it can be categorized into three parts. A pre-renal part where the blood supply to the kidney is compromised because of multiple factors including low BP. Here we can get causes like diarrhea, we can get causes like hemorrhage causing massive blood loss where the BP may go down, or there may be cardiac or liver failure, or there may be renal artery stenosis where the artery gets narrow and the blood supply to the kidney gets compromised. The second part is the renal cause. Commonly there are some diseases which affect the kidney directly. Commonly in ICU setting the most common cause is sepsis. It can be because of an urine infection or lung infection or multiple infection. There can be certain other disease called glomerulonephritis which can affect the kidney directly and can give rise to AKI. Here we call it RPGN. The third part is drug-induced kidney injury, which is called acute interstitial nephritis, which can be caused by side effects of certain drugs, commonly over-the-counter use of painkillers, certain antibiotics, certain diabetics. It can rise to kidney injury as well. And a third and the most treatable part of them is the post-renal cause or the obstructive cause, where the kidney flow, where the urine flow can get obstructed and give rise to an AKI, like commonly benign prostatic hypertrophy in an aged patient, renal stone obstructing both the ureters. There can be CA cervix, carcinoma cervix in female patient, which can obstruct the kidney urine flow. There can be clots in both the ureter or in the bladder outlet, which can obstruct the kidney flow. This can cause AKI. Now, how do you identify the patient is having AKI? Most of the times, in admitted patients, they can be monitored by certain tests, but in home, we mostly don't have any symptoms other than patient may have a drop in urine output, he can develop swelling, he can develop nausea, decrease in appetite, he can develop delirium, confusion, or it may affect heart, brain separately. In admitted patients, we generally monitor the urine output, tests like urea creatinine, USG of the kidneys, and the urine test to detect AKI early. And the treatment of AKI is mostly the treatment of the disease itself. In case of those who are volume depleted, we give saline. For those who have a low hemoglobin, we give blood. We try to maintain the blood pressure above a certain level, which helps in urine formation. If there is any renal stenosis, we try to remove the stenosis by doing angioplasty. Or in case of diseases affecting the kidney, we try to treat the infection or the glomerulonephritis itself. And for the obstructive causes, we try to remove the obstruction as quickly as possible by doing surgery, which can be invasive or non-invasive. Generally, the prognosis of AKI, if it is diagnosed early, is good. But I can say AKI begets AKI. Once you are having an AKI, that doesn't mean that you are safe when the kidneys come back to normal. Once a patient develops AKI, if he goes back to normal life as well, in future, he may have a chance of further developing AKI once again, or developing CKD, chronic kidney disease in future, or patient may have any cardiac impact or impact in the brain. So a patient who is developing AKI should be under regular follow-up of a proper nephrologist. Thank you.